is often not the case, as some children do not have the opportunity to receive the full course of all immunization due to certain limiting factors such as ignorance, hesitancy, inaccessibility. I identified the problem related to our nation, Nigeria, as it comes to vaccination. I discovered that vaccine hesitancy has been a major issue, ignorance about vaccine benefits and awareness, misinformation about vaccine due to social media information, the impacts of the COVID-19, poor commitment to policy framework by policymakers, poor access to immunization centers, health workers' attitude, you can go on and on. What's the consequence of all this? The gap in immunization in Rivers State is my target state, are characterized by several factors. This cuts across high child mortality, endemic disease outbreaks, significant socio-economic burden, least dose and zero dose. Then in places like Obiakpo local government area, because I'm actually targeting 3 local governments and Obiakpo is one of them. The consequence stems from low awareness, misinformation, logistical issues, systematic weakness. However, I'll be concentrating on low awareness and misinformation. In view of this, I propose a change. My change is to build confidence of at least 20,000 people from underserved rural population and slums in Obiakpo local government, Obiakpo, Ikwere, Port Harcourt local government areas, Rivers State, Nigeria, in conversation on vaccines and routine immunization by September 2026. So I believe I'll be able to achieve this. And I said this objective will be addressed by training and deploying 20 community identified volunteers to support vaccine uptake and address misinformation. They utilize indigenous language to correct vaccine myths and misconception, identifying zero dose and other immunized children and facilitate their access to vaccination. The pillars I'm looking at, based on what we were taught yesterday, are these 3 pillars. Sorry, that's communication, please. The specific objective. For advocacy, I want to ensure that the State Primary Care Management Board integrates information into their communication initiative regarding vaccines, because sometimes they create awareness when it comes to certain immunizations, so they should do that. Then for leadership, to build knowledge of 20 community identified volunteers and online influencers with information about vaccine preventable disease and community engagement by May 2026. Then communication, to engage at least 20,000 people in conversation about misinformation and importance of vaccine and routine immunization. My critical pathway for objective 1, I said, facilitate advocacy visits to the Rivers State Primary Healthcare Management Board, then obtain commitment from them to integrate countering misinformation in their communication initiative by April. Then obtain a letter of approval from the board and support in-paid radio jingle to demystify myths and misinformation. For objective 2, I said to set selection criteria for nomination of volunteers, review the list of nominated volunteers, organize and train nominated volunteers on vaccine misinformation and community engagement. For specific objective 3, I'm looking at facilitate outreaches at various community level, hold media talk shows in collaboration with the state agency and other CSO, then facilitate house-to-house engagements. My targets under advocacy are the government agencies. On leadership, I'm targeting the community volunteers. Then on communication, I'll target the 20,000 general population, through which we will have the demand generation and reach other CSOs for the zero dose and the hard to reach communities. Still under stakeholder, the targets. They're looking at community groups. Thank you.
Who go here that one where you put?
Okay, comment from you, contribution. Okay.
So just maybe I missed it. Sorry if I did.
Mike.
thank you for the presentation, very clear. But maybe I missed this, but did you specify you specified the different objectives, it's quite detailed, but did you specify the overall objective?
I think there's that.
The overall objective?
Yes.
Your change objective?
Yes.
Yeah, maybe I missed it.
Actual
I saw the specific ones.
You didn't see the major one?
She did it.
That's the specific, the major objective now. Sarah. Oh, Sarah. So this is my main objective, then there are other very specific objectives. That's the main objective, the change objective. Then I also have the specific objective followed.
Okay, yes, thank you, Rhoda. This is a great presentation, I think. My comment will go to the activities, mainly regarding activities, the communication activities. So maybe we need to go from that to see how we can create some synergy between the many activities that we have, and maybe reduce also the cost to be more efficient. Yes, I saw also that you planned some activities in October. Maybe if you can bring them back to September, it would be good. This is something that we need to see if feasible or not. Thank you.
Can I get clearance, please? Well done, thank you for the, well done. Like, I want to get clearance. Yesterday, we were told that the critical pathway is supposed to be like expected outcomes. But I'm seeing it as activities. Yeah, I don't know whether it's my
Yes, you are right, and those are the comments I'm writing, because what I'm saying is not what's needed to be done. So the critical pathway are the expected outcomes. So they should be written as expected outcome, not activity or objectives. But we can cover this later. Thank you, Rhoda. Do you want to answer to?
Yes, I was actually looking at what others presented. I knew that critical pathway was wrong, but I was surprised nobody said anything. It's not my friend I saying it. Thank you.
Thank you.